Hello, my name is Ashley Mariano and I will be presenting on dengue fever. Dengue fever is a mosquito-transmitted virus and it poses a significant global health threat by being the leading cause of arthropod-borne viral disease worldwide. Now, arthropods being invertebrate animals such as insects and crustaceans. Symptoms of dengue fever include muscle spasms, joint pain, and high fever. Studying this disease is very important since dengue fever presents a substantial public health challenge with over 100 million cases annually and 20 to 25,000 deaths. Personally, I was interested in studying this disease as someone who is from the Philippines, a place where dengue fever is prevalent year-round and continues to grow as a burden for the country. Now for this presentation, I will be explaining an article titled A Case Control Study to Determine the Risk Factors of Dengue Fever in Chattogram, Bangladesh. This study took place in Bangladesh, a country in South Asia where its climate favors the growth and reproduction of Aedes mosquito vectors. This study was conducted to explore potential risk factors for and their association with dengue fever. Now to talk about the population that was studied, as mentioned in the article, there were 150 confirmed dengue fever patients that were chosen to be observed for the study, and there were 150 non-dengue fever patients chosen to be in the control group, so 300 patients total. All of these patients were admitted to Chattogram Medical College Hospital, or CMCH, and Bangladesh Institute of Tropical and Infectious Diseases, or BITID, in August and September of 2019. The patients chosen to be in the control group were admitted to other departments within the hospital of CMCH and were matched to the patients from the cases group based on their gender, age, and location. Now to talk about the type of study that was used as described in the article. The researchers chose a case control study. Now this is a study that compares two groups of people. One, those with the disease or condition being studied, or the cases group, and a very similar group of people who do not have the disease or condition, which are the control group. This study is significant because it allows the this type of study is significant because it allows the researchers to study the medical and lifestyle histories of the people in each group to learn what factors may be associated with the disease or condition of interest. Now let's go ahead and dive right into the study itself, or the article. As mentioned, the study used 300 patients' data to compare possible variables that would be risk factors associated with dengue fever. To obtain and organize the information from the two groups, a 24-variable questionnaire was designed and used on both the case and control groups. This questionnaire possessed a range of demographics, travel history, daily life activities, family status, house, and surrounding environment type questions for those variables. Although both groups were able to complete the same questionnaire due to increased regulations on the dengue wards from both of the institutions, from the hospital and the institution from where the patients were from, the case group filled the information on the questionnaire through phone interviews conducted by the trained investigators One Health Center for Research and Action team. To ensure reliability, the team members thoroughly discussed the questionnaire and pre-tested it before starting the final data collection. Verbal informed consent was taken from all the respondents, and confidentiality was ensured throughout the study. Participation in the study was voluntary, and no incentives were given to any respondent. In regards to the inclusion criteria for the participants, as mentioned above, all of these cases were confirmed dengue patients diagnosed by antigen test and were admitted in the hospital, the CMCH and BITID, again during this August and September of 2019, whereas 150 controls were non-dengue patients admitted from the other departments and were selected again through matching by age, gender, and geographic location. Now, due to the telephone interview, the response rate was a bit lower. Instead of 100%, it was 77.47%. A few contact numbers were found wrong, out of service, unresponsive, and or the number holder was the patient's relative that answered the phone. Moreover, patients who failed to respond to all of the questions properly or left without completing the interview were excluded from the study. In regards to randomization, no randomization was conducted since researchers sought dengue patients specifically and other patients for comparison specifically. Now, to talk about the statistical analysis, there were a few statistical tests that were used. They used a chi-square test, a binary logistic regression analysis, a Hosmer-Lemeshow test, and an omnibus test. A chi-square test is a statistical test used to compare observed results with expected results. A binary logistic regression analysis measures the relationship between the categorical target variable and one or more independent variables. The Hosmer-Lemeshow test is a statistical test used to assess the goodness of fit of a logistic regression model by comparing observed and expected event rates in subgroups of the model population or to test the previous test. Finally, an omnibus test is a statistical test that examines the overall significance of a model or hypothesis, indicating whether there is a significant difference somewhere within the data, but it doesn't specifically pinpoint the location or nature of the difference. At first, the researchers performed a chi-square test for all the variables to test the significant differences between the case and control groups and screen the variables of interest. Later, the binary logistic regression analysis was used to analyze the statistically significant variables found from the chi-square test and logistic regression. Found from the chi-square test, further affecting dengue incidence. Now, the p-value was less than 0.05. The p-value was set to 0.05 for the significance level of the chi-square test and logistic regression. In addition, for the odds ratio with a 95% confidence interval were used to express the degree of associations and to determine the risk and protective factors. The Hosmer-Lemeshow test was chosen to test the goodness of fit of the logistic regression model, as mentioned in our definition earlier. They found that the full model containing all predictors was statistically significant through the omnibus test with the chi-square value of 316.48 with a p-value of equaling 0.000. And the Hosmer and Lemeshow test showed a value of 0.81. The model correctly classified 93.7% of dengue cases. Now to talk about the results and conclusion. With the study population of 300 with an equal number of cases, between the case and control groups, the male and female ratio was 1:1. So there's an even number of males and females, and frequencies of age categories and geographic locations were also matched in both groups, just so that they're similar enough to be able to compare, so they were good numbers to test. The higher proportion of cases was male, which was 70%, and equaling 105 out of the 300, and belonged to 16 to 30 years of age. Most of the dengue patients had lived in the urban area, or 60%, about 60%, and were permanent residents of the city. Among demographic factors, no significant differences were found among the age or gender or geographic location, with p-values corresponding 0.99, 1, and 0.9 between cases and control groups. On the other hand, the patient's occupation, residential status, travel to the capital Dhaka, and the presence of comorbidities have shown statistically significant differences between the groups. Moreover, various housing and living environmental related factors also showed a significant impact to be a risk factor for dengue infection. The person living or working with a dengue patient, the place we're staying for more time of the day, walking outside, especially in morning and evening time, the habit of daytime sleep was found more important for dengue cases. In addition, housing type, structure, age of the house, age of the household members, number of family members, and the average number of people living in a room revealed significant differences within the case and control groups of the participants. However, the indoor daylight and ventilation status of a house in the presence of a bus stand or garage, stagnant water, and a construction site within 250 meters surrounding the house were not statistically significant for the spread of dengue infection. Now for our bias and limitations, and also just my opinion regarding the conclusion of the study. Overall, the study clearly displayed the association of various risk factors for dengue fever transmission. Traveling to dengue prevalent areas, staying most of the time in office, living in old houses over 20 years, and temporary living in rented houses in various parts of the city have significantly increased the risk of dengue infection. And dengue outbreak could be influenced by someone's lifestyle and the structure in and around the house, enhancing mosquito breeding and survival. Therefore, sustainable dengue control strategies should be prioritized for mass awareness programs to promote safe housing and healthy lifestyle among communities. I agree with the conclusion based on the statistics and evidence provided by the research group. However, there were some limitations and bias I observed while analyzing this study. The researchers mentioned that there were a few limitations explicitly stated as they conducted the study. First, they conducted phone interviews, as mentioned earlier, due to the restrictions enforced by CMCH and BITID, which collected poor and incomplete responses for some of the patients. Secondly, the sample size that was involved in the study wasn't that large of a sample, which could have allowed for more significant results if it were bigger. However, the researchers claimed that they made sure to interview the patients 1 week after the patient's release from the hospital during the outbreak period to allow a lesser chance of recall bias. I did believe that there was a selection bias being selection bias in research occurs when the way participants are chosen for a study leads to a sample that does not accurately represent the target population, potentially skewing results and conclusions. I believe this is because the researchers limited the cases and control to one location, which could not accurately represent the greater majority in a population. In addition, environmental parameters, the water storage system in the home, and knowledge and awareness of the house head could alternate the course and severity of the dengue infection, which were not considered in the study. Just to reflect, as a whole, I believe that the findings in the research applied to the population they were concerned about. It was mentioned previously how Bangladesh has ideal conditions for dengue fever, and the researchers were able to expand and explore the risk factors associated with the disease to better help that community create solutions to decrease the morbidity rate. I also believe that case control study design was ideal for the research because case control studies can study multiple exposures and are useful in disease outbreak investigation and can focus on starting with the outcome of disease rather than the exposure, so the researchers can study a greater number of cases in less time. Thank you for listening to my presentation. I hope you enjoyed and were able to learn more about dengue fever. Have a great day.